Hello, good afternoon. My name is Dr. Chudi Ufundu of Snowspirations Global Health Solutions. And today is the 14th day of January 2023. Now, today we're going to talk about blighted ovum. Blighted ovum. Blighted ovum is actually a type of miscarriage. And miscarriage is the unintended end of an ongoing pregnancy before 20 weeks. Blighted ovum is also called anembryonic pregnancy or anembryonic gestation. So this will be the topic of my discussion this afternoon. Unfortunately, this is common. Unfortunately, some pregnancies will end up becoming blighted ovum. It's possible you've experienced this, and it's possible you're wondering if you're ever going to be a mother again, if you're ever going to become pregnant. The good news, majority of women that had this problem still went ahead and had their babies. So you are going to have your rainbow babies. So rainbow babies are those babies you're going to have when you've had an unfortunate end of an ongoing pregnancy. So if you've experienced blighted ovum in the past, joy will still come to your home. The storm will end and the sun will rise again. I plan to spend about 30 minutes. The first 15 minutes will be my presentation. The second 15 minutes will be my Q&A. So please, when you join, announce who you are. And I'm going to start. Once I have a good number, I'm going to start. Now, immediately after this clinic, I will go to our Facebook page and I'll repeat the same topic. So if you're not able to participate fully in YouTube, don't worry. We're going to have another repeat section in our Facebook. My name is Dr. Chudi Ufundu. I'm the convener of this group. And every Saturday about this time, we normally rally to talk about important topics. Now, because this is a loss of pregnancy, is a topic that gives me a lot of pain, but it's a topic we need to talk about so you will understand it better. Okay, so I'm going to start actually. So unfortunately, when you suffer blighted ovum, it simply means that the current pregnancy, which you might have checked with your urine pregnancy test strip, which you might have checked with your blood test, and they were positive. In blighted ovum, unfortunately, the gestational sac, which is the evidence of pregnancy, did not go further to develop and become an embryo. So blighted ovum is simply an empty womb. Very unfortunate development. There is no embryo. So the pregnancy test you got, which was positive, at the time we are anticipating that everything will be going okay, there is no formation of the embryo. Or there was formation of embryo, then it suddenly stopped. So two scenarios. One scenario, no embryo was formed. Gestational sac is the only evidence where there is no embryo. Second scenario, there was an embryo, but unfortunately it stopped developing. Any of these scenarios can play out. Unfortunately, we don't know for sure what causes this. However, based on the fact that it's pretty much fairly common, some school of thought believe that it's something to do with chromosomes. So when this happens, when the developing embryo is actually part of the specific type, over time the body will absorb and reabsorb that embryo, and there will just be an empty gestational sac. Normally, the gestational sac is supposed to have a gestational pole and other things that will tell us that the pregnancy is going okay. Now, most women that will have blighted ovum will notice this within the first weeks of pregnancy. So possibility that blighted ovum will happen around the 5th week, the 6th week, the 7th week, the 8th week is very high. This is the commoner period that blighted ovum will happen. Now, most people will have this very early in pregnancy that some women will not even know they were pregnant and blighted ovum happened. In some women, they will be aware that they are pregnant, especially if you are actively wanting to become pregnant. So women that are actively wanting to become pregnant will definitely be checking their pregnancy every month. So if you're in that category of believing for a baby and you constantly check for pregnancy, then you might know you are pregnant based on the changes you will notice in your body and based on the fact you go for your pregnancy test. So the normal sequence for is positive pregnancy test, urine, positive pregnancy test, blood. Unfortunately, when we go for the ultrasound, we see an empty sac, no evidence of developing baby. This is the reason why we encourage you to register for ANC. This is the reason why we encourage you to confirm your pregnancy before going public. Urine pregnancy is not confirmatory of pregnancy. Blood test is not confirmatory of pregnancy. The only clinical confirmation of pregnancy is ultrasound. So we need to see that baby developing inside the womb. Until we've seen the baby developing inside your womb, you are only classified as chemically pregnant. At the point we see the evidence of a sac, of a pole, an embryo developing inside your womb, then you are confirmed clinically. Now, what are the likely symptoms of blighted ovum? Some women will have minor belly cramping, minor. Some women will have light spotting, and some women will bleed frankly. This is why in pregnancy, anytime you notice any sign of bleeding, anytime you notice any sign of blood, light, heavy, that's a danger sign. So it's not all women that will have light bleeding. It's not all women that will have minor cramping. It's not all women that will present with classical presentation of blighted ovum, but this is common. So minor belly cramping is common, light spotting is common, bleeding is common. Now some women will develop breast tenderness, vomiting, then over time, the embryo, if the embryo was inside, will stop developing and the hormones will begin to decrease. So it's expected that if a woman that had blighted ovum has completely expelled the contents of the baby from the womb, then the hormones for pregnancy will start coming down. Unfortunately, in some women, this will not happen. Now, at the point you are having minor abdominal cramping and spotting, then bleeding will also happen. Now, eventually, you're gonna miscarry the baby. Miscarriage means the baby will start leaving your body. So the contents of the baby will start escaping from the vagina, which will come in form of blood, which will come in form of your water breaking. So this is the normal way that blighted ovum will present. Like I told you guys, unfortunately, we don't know what leads to this. And unfortunately, it cannot be prevented. But we know somehow it has to do with abnormality in the fertilized egg. So for some reason, maybe the sperm had some problems, the egg has some problems, and the union of the egg and the sperm, which should lead to an embryo, did not happen as expected, and unfortunately, pregnancy did not continue. How can we diagnose this? Remember, the diagnostic criteria of a normal pregnancy is what? Ultrasound. So ultrasound is the gold standard in diagnosing blighted ovum or anaembryonic pregnancy. So every pregnant woman is encouraged to go for routine ultrasound. So when we run an ultrasound, we'll see an empty sac. However, when we run the pregnancy test, some women will still be positive because once you've had an embryo developing, placenta will develop. And when placenta develops, placenta will keep releasing the human chorionic gonadotropin, which is the so-called pregnancy hormone. So the way to know if you have blighted ovum or not is to go to your gynecologist, and your gynecologist will run an ultrasound to confirm. Now, how can we manage this? So management means we've already confirmed, unfortunately, that the baby is not developing. What can we do? Expectant management. Some women can choose to wait for the miscarriage to take place, to happen naturally, while in some cases we'll give you some medication to trigger the miscarriage. Now, in some situation, we might give you the medication and we'll still have remnants of the baby inside your body. In that situation, we'll schedule you for what we call D and C, dilatation and curettage or evacuation. Now, most women that have blighted ovum will subsequently go ahead and have normal pregnancy. So the fact you've had it before doesn't mean you're not going to have your baby. So if you experience multiple miscarriages, which is more than two, then we need to escalate and look at things differently. If your body doesn't have a pregnancy subsequently after having blighted ovum, then you have secondary infertility. So it's important we follow due process in managing blighted ovum. Once we confirm you have blighted ovum, three ways. We can allow your body to expel it. We can give you a drug we call misoprostol. Misoprostol is a drug that will remove the baby normally developing in your body by allowing your body to abort the baby. Now, if that one doesn't work, we go for D and C. D and C stands for dilatation and curettage. We open your cervix, we dilate it, we make it very visible, then we go inside and remove the baby under anesthesia. Now, these are all options that are available to women depending on the one that will work for you. So your management is based on your unique situation. If you are blessed and the blighted ovum happened completely and your body expelled everything, then you will not have a need for drugs. You will not have a need for evacuation. You will not have a need for D and C. Now, how long does it take for your body to recover? Recovering from blighted ovum after D and C might last for 1 or 2 weeks, and in some women, it might extend to 1 month. Now, subsequently, after you have recovered, or in course of your recovery, some women will begin to have cramping that might last up to a week. Some women will continue to bleed for several weeks. It's expected. Don't freak out. Your body is trying to normalize. Now, as you are getting further, your bleeding will continue to be lighter, then over time it will stop completely. You can resume your normal activities as soon as you feel comfortable. Now, if your bleeding increases, especially when you're engaging in strenuous exercise, please go easy. Your hormones are trying to come back to normal. So your body is still, trying to understand what happened. Most people will get their period within 4 to 6 weeks after having this problem. Now, it might take longer to recover emotionally when you've had this. So your recovery is tailor-made, but you can recover and you can become pregnant again and you can have your baby again. Now, unfortunately, you cannot prevent blighted ovum. It's going to happen. It's going to happen. Now, some couples might opt to go for genetic testing depending on availability and depending on need. Now, how soon after blighted ovum can you get pregnant? Most times, we want you to recover. You see, when you've had miscarriage, when you've had stillbirth, the question is not how soon you can become pregnant. The question is, have you completely recovered physically, mentally, psychologically, spiritually? Have you dealt with the situation that just happened to you? So it's important you take time. But most providers will allow you to have complete recovery of your period. So you would have had 2 regular menstrual periods before we will tell you to go and start planning for another baby. Now, the possibility of you having another blighted ovum is very low. Majority of women that have blighted ovum will have it once and they will go ahead and have healthy pregnancy. So it's low. So the fact you've had it before doesn't mean you're going to have it another time. Thank God for that. So if you've had blighted ovum once, please make sure you're fully recovered and call your doctor before you begin to plan for another pregnancy. Now, when should you see your doctor? If you notice excessive bleeding after all these procedures I've mentioned, if you notice dizziness and fainting, anytime a woman is noticing dizziness and fainting, it's possible you're bleeding internally. If you notice fever and the fever is not going away, if you notice that the symptoms is actually getting worse, please ring your doctor and go see your doctor immediately. When should you go to the hospital as an emergency? Please go to the nearest ER if you experience very heavy bleeding, which can soak more than 2 parts per 1 hour, then please go to the hospital immediately. If you notice that your heart is pounding and you're feeling dizzy and you're feeling like you want to pass out, it's a danger sign. You have to go to the hospital immediately. Okay, so this is my presentation on this. Now I'm going to open the clinic to give you an opportunity to ask your questions. Okay? So the clinic is open now. Please feel free and ask your question. I can see a very low attendance. I understand. It's those topics you don't want to listen to because nobody wants to hear about tragedies. I understand. But this is a topic we need to understand appropriately. Please start asking your questions. What puts you at risk for blighted ovum? Remember, anytime we talk about risk, we'll talk about prevention. Unfortunately, we don't know exactly what leads to this, and there is nothing you can do about preventing it. So I can't say, oh, this is the likely thing that will put you at risk. So I will just say this. Once you're pregnant, the possibility that your pregnancy might be blighted ovum is there. So one risk factor is pregnancy itself. But there is no known, oh, when you do this, then blighted ovum is going to happen because it's chromosomally determined. Chromosomally determined means you didn't do anything special. There was nothing you did that caused this. It's just your body telling you, you know what? I don't want this baby. Our body wants the best. Once the baby developing inside your body is not the best, the body has a way of telling you, you know what? I don't want this baby. And the body will push out that baby. That's what happens in most miscarriages. Okay? All right. How can blighted ovum be prevented? I believe I've already answered that same question. There is no way you can prevent this. And I'm just going to say this generally. If you are intending to be a mother, there are so many lifestyle modifications. Of course, you need to eat right. You need to stop drinking alcohol. You don't smoke. You exercise. You avoid stress. You sleep. So by default, if you do all this, if you eventually become pregnant, the outcome of your pregnancy will be better. But there is no specific thing you can do to prevent blighted ovum. It's going to happen. It's going to happen. Okay? All right. Keep asking your questions. Thank you, Doc, for this teaching. For a woman who tested positive to pregnancy, but later discovered the pregnancy is no longer there without bleeding. So what's your question, mother? Now, even in normal miscarriages, one of the things we normally check is what we call dilution. So if you experience miscarriage today, besides going for ultrasound to confirm you've had miscarriage, we will want you to go to the lab to keep checking the level of your beta HCG. It's expected that when you are no longer pregnant, the level of your beta HCG will start decreasing up to the point that it will get to 0. But if your baby is no longer alive, if you did not expel all the parts of your baby from your body, your beta HCG will not come down. Some people's own will even go up. Now, there are other conditions that will also make your beta HCG to go up when you don't have a viable pregnancy. If you have a type of pregnancy we call molar pregnancy is an abnormal pregnancy that when you have such, the level of your beta HCG will go up when you're not pregnant. Or if you have ectopic pregnancy is also a pregnancy that is abnormal because it's not developing inside the womb. If you have such, pregnancy is developing somewhere in the tube. And in that situation, your beta HCG will go up. So it's important to present to the doctor so we can monitor you to make sure that that beta HCG is correspondingly going down. We don't want it to be going up. Once it's going up, then we need to make sure we've removed all the parts of your baby from your body. Okay? All right. Please keep asking your questions. Keep asking your questions. How long can a woman carry blighted ovum? The earlier it's diagnosed and removed from your body, the better. There is no time frame. Anytime a pregnancy is no longer viable, it's better we expel all those baby's contents from your body. Some women will opt to go the natural way. Some women will use what we call expectant management. Your body will expel it, you will bleed for some time and it will stop. And some women will prefer to end it immediately. So some women will actually tell you, please give me some drugs. Please go for evacuation because they want to end that nightmare immediately. But some women will prefer to do it the natural way. So the earlier blighted ovum is diagnosed, the better it's removed so your body can recover and you increase your chance of becoming pregnant again. Okay, Is it hard to get pregnant after blighted ovum? No. Once you've had the return of your bleeding, at least 2 cycles. So once you've bled for twice in a normal cycle, in a normal bleeding, which is not spotting, which is not abnormal bleeding, then at that point, so the third bleeding, your provider will say, okay, let's go back again. Becoming pregnant after blighted ovum is not difficult, and the possibility you will have a repeat blighted ovum is limited. However, if you have it again more than twice, then we need to go further to check other things that might be leading to recurrent miscarriages. So becoming pregnant after blighted ovum is completely straightforward. You can become pregnant after having blighted ovum. All right? Keep asking your questions. If we don't have any other question, we've actually reached the 20th minute mark. If you no longer have any question, then we can end this clinic so we can go to our YouTube and continue our conversation. So please, if you have any need to ask questions, even if it's outside this particular topic, please feel free and ask right now. I'll provide you feedbacks before I go. What's the main cause of blighted ovum? We don't know. The cause is unknown. However, some researchers believe it has to do with abnormality in the egg. So we don't know for sure. There are so many things in medical practice we don't know the cause. We don't know the cause of hypertension. We don't know the cause of diabetes. Of course, we don't know the cause of blighted ovum. So many things. The ones we know, we'll tell you. The ones we don't know, we won't tell you. Okay? All right. Do you still have any questions? If you have any question, please feel free to ask before I go. Ask before I go. Okay. So I believe at this juncture, we can take our leave. And I want to thank you for attending this clinic. Remember, Saturday's clinics come very early. So about this time, 6 p.m. Nigerian time, 12 p.m. Eastern time. Our clinic today was delayed because we were anticipating a greet and meet with Dr. Ndiche. Unfortunately, it looks like people didn't show up, but that's okay. But Saturdays, if you want to attend this clinic, then please attend about the neighborhood of 6 p.m. Nigerian time. Okay? All right. Okay, so at this juncture, I'm going to take my leave, and I want you to join me in Facebook immediately, and we'll continue the conversation. Thank you so much for coming. Remember to register for the event on the 29th. We have our first fertility summit, SGHS Fertility Summit. If you are having challenges becoming pregnant, sustaining your pregnancy, becoming a parent, becoming a mother, becoming a father, we want you to attend with your partner on the 29th of this month. Come with your problems. Let's fellowship, and by the grace of God, we will overcome. So I'm hoping to see you guys on the 29th. So go and register today. We have just few slots. Until I see you guys, enjoy your weekend, and bye-bye for now. God bless.